World Tuberculosis Day is commemorated annually to raise public awareness about the devastating health, social, and economic consequences of tuberculosis, and to set up efforts to end the global tuberculosis epidemic. The date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes tuberculosis, which opened the way towards diagnosing and curing the disease. World Tuberculosis Day is also a day to educate the public about the impact of tuberculosis, along with other health organizations around the world, as they share their successes in tuberculosis prevention and control and raise awareness of the challenges that hinder their progress towards the elimination of this devastating disease.
My name is Dr. Oluwaseyi Ayola Williams. I'm a medical practitioner and I'm a clinical microbiologist. I practice presently in the National Hospital, Abuja, in the Department of Medical Microbiology and Parasitology.
Tuberculosis, which is usually referred to as TB, is a potentially serious infectious disease that mainly affects the lungs and other parts of the body. TB is an infectious disease that has been around for thousands of years, although it is still common and fatal in parts of the world. TB can be fatal, but in many cases, it is preventable and treatable.
World Tuberculosis Day is an opportunity for all hands to be on deck to fight this so-called tuberculosis. It's not a new name, it's not a new disease, but it has remained a menace, in the society. Since prehistoric time, tuberculosis is an infection that is caused by a group of bacteria that is referred to as the Mycobacterium tuberculosis species, but the most important one of them is Mycobacterium tuberculosis. It's an infection that can affect any part of human body. The lung, just name it, the eyes, the skin, the reproductive organs, any part of the body can be affected by tuberculosis. And tuberculosis is a chronic infection, that is to say, it starts slowly, insidiously, and before you know it, it becomes something big. And that at the end of the day, if not treated, it becomes eventually fatal.
Historical data suggests that tuberculosis mostly affects adults in their most productive years, and that is between the ages of 12 and 24 years. There may also be a transient increase in the risk of progression to disease after infection compared with children or older adults. However, all age groups are at risk. Over 95% of cases and death of TB are in developing countries.
Tuberculosis affects all age groups, but it's commoner among, unfortunately, the young and the productive age group. In most parts of the world, it's commoner among people between the ages of 15 and 45. These are the people that are schooling. These are the people that are actively working in the nation. And so that is why eliminating tuberculosis is a fight that all of us must put our hands into. These same people, if we are losing them, we are losing the economic workforce, the workforce of the nation, even among the people that are supposed to replace the next generation of workforces, we will be losing them.
Tuberculosis was once a death sentence. Doctors could do little to treat it, and almost nothing was known of its spread until two physicians, Robert Koch and Arthur Doyle, changed that narrative.
Tuberculosis is an infection that might look like a spiritual attack. In fact, everybody would have still believed that it is a spiritual attack. If not that sometimes in 1882, due to some breakthrough that God, I believe, granted the scientific community, the World Tuberculosis Day is actually marking that day that Dr. Robert Koch was able to present before a scientific community that he has discovered the cause of tuberculosis. Before that time, having tuberculosis is a death sentence. You know, during the White Plague in Europe, 100%, almost 100% of Europeans were infected with tuberculosis. And when you hear 4 people died, when you have 4 people just died, 1 out of every 4, the death was usually due to tuberculosis. Even if you talk to our grandparents, our parents, so many of them had experiences with tuberculosis where they told them this cough cannot be cured. Until this breakthrough came and some drugs were being discovered in the early 1940s. That is when hope started. Before, people would just cough and cough and cough until they dry up and most of them die.
Tuberculosis is an infectious disease that typically affects the lungs, though it can also involve other parts of the body. When it affects the lungs, it is called pulmonary TB.
We broadly divide them into two pulmonary tuberculosis, which accounts for more than 95% of all TB cases. Like I said earlier, you can have TB in your abdomen. That's a layman's term. Anywhere from your mouth to your anus, that's your gastrointestinal system. Any part of that can be affected by tuberculosis. You see some people with swollen abdomen. We say it's abdominal TB. It used to be common in those days when we drink milk raw without pasteurizing it. That is what led to the pasteurization of milk. You see that all those liquid milk we drink now, they write pasteurized. That came about because a lot of people drink milk, raw milk from the cow, and most cows too many of them are infected with we have different strains of Mycobacterium tuberculosis species. Like I said, Mycobacterium species, they can cause different kinds of tuberculosis. In cattle, many cattle are even infected. So by drinking the milk, you can have a form of tuberculosis. Okay, some people have it in the reproductive organ. You can even have it on the skin. Okay, you can have it in different parts of the body. Let's focus on pulmonary tuberculosis because that is the one that spreads easily to other people. And if you can actually control pulmonary tuberculosis, we would have controlled to a large extent the menace of TB. That is, pulmonary tuberculosis is talking about the chest, respiratory system, part of it, the lungs being affected by tuberculosis. Most of the time, patient can just discover that he's sweating in the night, even when everybody is looking for, he's saying that everywhere is cold, he's saying it's warm and he's sweating. Even if there's fan, he's sweating. Then he has this fever that is low grade. It's when you touch him, why is your body warm? Low grade fever, not very high fever that's always there. You see this person beginning to lose weight, even though he's eating. He can eat, but it's when the disease is getting to the tail end that he might lose his appetite. But at the beginning, it's eating well, but he's losing weight. You can discover that he's becoming weak. Most of the time, people will cough, and this cough will be more than 2 weeks. He has used whatever it is, over-the-counter medicine, and this cough is remaining. For some, the cough is horrible. For some, just a mild cough. That when they produce sputum, it might be yellowish, it might be whitish. Sometimes they might not even produce sputum. Okay, sometimes they spit blood when they cough. And then when they cough, they might have pain in their chest. These are some of the signs and symptoms of pulmonary tuberculosis, especially in a cough that has lasted for more than a week. If the patient or the person has HIV, in fact, any cough doesn't have to be more than a week, it doesn't have to be more than 2 weeks, because people that have their immune system suppressed, either because of the drugs they are using or because of the diseases they have or their lifestyle. For example, HIV patients, people that are diabetic, people that smoke a lot, people that take a lot of alcohol. Okay, these people that have cancer or they are on cancer treatment, for one reason or the other, their immune system is not optimal. People that are malnourished, these kinds of people, when they have this cough or these symptoms that I just described, you have to have your high index of suspicion and check, think twice, it's maybe TB.
Tuberculosis is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via coughs and sneezes. Only person with active TB can transmit the infection. However, most people with the disease can no longer transmit the bacteria after they have received appropriate treatment for at least 2 weeks.
A lot of studies have been done into tuberculosis, and at least to a large extent, we know that tuberculosis, the agent, that is why we are celebrating the World Tuberculosis Day. It was sin. It would have remained a spirit. We can see how it looks like. We know what it feeds on. We know what makes it happy, and we know some drugs that kills it. That's why we are happy, and we are trying to do our possible best that TB should not kill anybody anymore. If we can trace everybody that has TB, you can diagnose them, you can treat them, and anybody that has been exposed to these people, we can give them some preventive therapy. We will eradicate, we will eliminate TB. And that is the reason why we are so particular about finding every single case of TB, is because the major mode of transmission is through cough and cough droplets. Similar to COVID, but not exactly the same. When people with TB cough, or they talk, or they sing, some of these germs causing TB they are released into the air. Okay, but unlike in COVID, they are in some small secretions, tiny droplets of secretions that may make them even remain suspended. Like in this room now, if I've just seen a TB patient that did not wear face mask when I'm seeing that patient, this room, and he has coughed into this room might still remain infectious for more than 24 hours, except particular decontamination steps we are taking, because they can remain. They are tiny droplet nuclei. They are suspended in tiny centers of droplets of mist coming from their nostrils and their mouth, and they can be suspended in the air. So when people whose immune system are down, when they are exposed, they breathe this thing in. It settles in a place in the lung, it starts to grow, and then it can begin to cause disease. Usually the immune system is strong. Your immune system attacks it and clears it off normally. But in that situation, when the immune system is down, you are not able to. Or even if the immune system is strong, if the amount that you are exposed to, the amount of germs is quite large, of course the person can come down with pulmonary tuberculosis.
Most people affected with the bacteria that causes TB do not have symptoms. When symptoms do occur, they usually include a cough, weight loss, night sweat, and fever. The treatment for TB is not always required for those without symptoms. Patients with active symptoms will require a long course of treatment involving multiple antibiotics.
When you have a loved one that have this kind of situation, it's good you go to the hospital together. Ask the healthcare provider all the questions. Don't listen to minds alone. If you have had them, bring them to the table so that they can be clarified for you. Okay? But it's good for us to know that with appropriate treatment, usually within 2 weeks. 2 weeks, just mere 2 weeks of taking your drugs as a TB patient, your ability to transmit TB to any of the other person is actually eliminated most of the time. We call them, we say you have been converted from open TB to closed TB. You have TB, but you are not really able to transmit to other people, because the ones that are there in your lungs that are easy to come out when you talk and do things would have been killed by those drugs. So the other sustained part, the rest of, is to make sure that the remaining, because the organism, it reproduces slowly, sluggishly. So if you don't keep using those drugs, those ones that are still trying to wake up, they have not been affected by the drugs where they are. They are not those ones are the ones we are targeting, and so that we can make sure we kill all of them. It might not be easy for you to know you have TB. A doctor can help to tell you that most likely you have TB by listening to your complaints, all those things I said earlier on. Okay, weight loss, cough, chest pain, weight loss, you are losing weight, you sweat in the night, and then the person checks your chest. There are some signs doctors can pick in the chest and say, no, this is in keeping with tuberculosis. In fact, sometimes we search for the organism, we can't find it in the test, but you have reasons to say clinically, let's treat this person for TB. Yeah, it can be done. But we want it to be confirmed that you have TB. Because treating TB is not one day's job. It's not 1 month's job. At least you use the drug for 6 months. So we need to be sure that you have TB. So that you will know the reason why you are drinking this drug. When when the treatment first came, it was one drug that was first discovered in the 1940s. That was streptomycin. They discovered that people were cured. But a few years after, most of them, they come back again with TB. Relapses, incomplete treatment, things like that. So they discovered that, this organism most of them actually have resistance to one drug or the other. That's why the treatment approach now is combination therapy. We call it multi-drug approach. Okay, so the drug they will give you is not one drug. Of course, we do combine the drugs to look like one, but we use at least 4 drugs to treat tuberculosis. So if somebody is going to use drug for 6 months, you have to be convinced that what you have is TB, isn't it? So, because if you don't complete your treatment, the TB will come back. And of note is the fact that it can even come back in a worse way. Because these organisms now become more special. They are used to drugs. We call them drug-resistant strains. You give them the usual drugs are no longer working for them. In fact, there are TB strains right now that no drug work for. Okay? 5% of all the TB cases in the world they belong to that category, multi-drug resistant tuberculosis. And we've had cases of totally drug-resistant tuberculosis until they died. Nothing could remove or eradicate them. So you have to know that you have it. So just run the test, and if you have it, we treat you. And because we don't want any other person around you that might have been exposed to tuberculosis to come down with tuberculosis, we want to screen them. Are we together? We want to screen them. And if we find reasons why we need to give them preventive therapy, we give them preventive therapy. The higher the closeness of exposure, maybe the person is unprotected, I'm not protected, the person is not protected, and we're together in an enclosed space without adequate ventilation, those things increases the risk. But when there is adequate ventilation, okay, that is why there is also the issue of socio-economic and other things, financial issues when it comes to tuberculosis. That's why it's higher among people with lower socio-economic status. You are in a room with only one small window. 6 of you are living in that room. It's not easy for them not to contact TB if one of them is having that tuberculosis. Okay, so close contact, that's what we talk about. Maybe you live in the same room, you work in the same office over time, day in, day out. It increases the risk that the person might come down with tuberculosis, especially if his immune system is down.
Many strains of tuberculosis resist the drugs most used to treat the disease. People with active TB must take several types of medications for many months to eradicate the infection and prevent development of antibiotic resistance.
Once you are recovered, it doesn't shorten your lifespan. But if it's not treated or not completely treated, some people, they will diagnose tuberculosis, they will say, no, over my dead body. They will use drug for 2 weeks and they will disappear. You can be sure that you might feel better. Most of the time, the TB will come back. And if it comes back, you start treatment again, you do 2 months, and I'm tired, you abandon your drugs. It will still come back. And by the time it's coming back, it might now become a drug-resistant tuberculosis that you may have to use drugs, sometimes 1 year. You're still using drugs. We are checking whether it's gone, it's still there. We are checking, those kind of people, how would it shorten their lifespan? Because you now have to use unconventional drugs that may be more toxic, drugs that are more expensive. In fact, these drugs are even scarce. You may be needing injections. You may need to be admitted before you can collect some of these drugs. It will affect. In fact, those people that have multi-drug resistant tuberculosis, 50% of them will die. Until now, that things are getting better when we have newer drugs. Up till this recent past, 1 or 2, because treatment success is about 53%. That is to say, if you give 100 people with NDR-TB, about 53% will do well. Others. But if it is a normal TB that you do all you are supposed to do, 83 out of every 100 patient that has normal pulmonary tuberculosis will be cured. 83% will be cured in most centers of the world. That is to say, doing what they're supposed to do. Even those other remaining people that are not cured, if you check very well, one or two things might have gone wrong. Maybe they're not using their drug well, one thing. But all things being equal, your PTB is 100% curable, still treatable.
The risk of infection can be reduced by using a few simple precautions, such as good ventilation, as TB can remain suspended in the air for several hours with no ventilation. Natural light. UV light kills off TB bacteria. Good hygiene. Covering the mouth and nose when coughing or sneezing reduces the spread of TB bacteria.
Prevention of tuberculosis is not one man's job. It cannot be limited to the hospital or healthcare providers alone. It's everybody's job. Because the problem is how do we find every single case of tuberculosis in the community? That's a challenge that we have. That's a challenge that we have. Because as long as there's one person in one community somewhere in Nigeria coughing, you continue to spread it. And we always have these cases. So everybody has to be involved. You find somebody coughing in your environment, this your cough is beyond 2. Why don't you go and check it? And we have a control program in the country, even globally. All hands have been on deck for a while in trying to eliminate this TB, such that TB diagnostic services, treatment services, they're free. You can walk to many hospitals. If they don't have that service in that health center, they will refer you to where you can do your testing. Either you test your sputum in the traditional way, or you use even a rapid molecular method that we use now, Gene Expert. You can, in 2 hours, you give them your sputum, you stay there, they do your test, you collect your result. It's TB, you get treated. It's not TB, other things are evaluated. So, if you have anybody, you are coughing, or anybody around you is coughing, and it's been a while, you are losing weight, please, ask for the nearest center where you can run a TB test. It will help. And then for clinicians too, all this category of people we talked about that have immune compromise in one form or the other, sometimes TB can present in a subtle way. It's only when we're always thinking about it that this person's immune system is compromised that we can find it. Because some of them might not really cough. Like people with, that's why we said any cough in HIV, they may not have any serious cough. It's when we are really thinking of it that we find it.
In Nigeria, treatment of TB is provided free of charge at public facilities, and it is based on the directly observed treatment, short course strategy.
Assessing the hospital, I'll say it all over again. Just hold your transport money. If that's all that you have in your hand, you are home and dry. You're home and dry. Any health center nearest you, because these facilities are widespread. So it's even not necessary to start giving you a list of hospitals either in Abuja here or in any other part of the country. Get there that you want to do that cough test for tuberculosis that they say is Gene Expert. Can I do it here? No, you cannot do it. Please, where is the nearest place where I can do it? They will refer you to the place. Before, diagnosing TB is a little challenging because you have to use microscope to look at that sputum, to look for it. What you don't know, can you identify it? So you need to have trained microscopists at the different levels of healthcare services, even from the primary healthcare centers up, to be able to do that. So if they look at it and they say they can't find it, it doesn't mean that it's not there. That's why they will say cough 3 times, so that if you don't find it today, we check tomorrow, we check the day after to improve the yield. Okay? So if they say it's not there, it doesn't mean it's not there. In developed countries, almost all any hospital you go to, you say they can rule out TB. If they take your sputum, they send it to the nearest laboratory that has the facilities. That is if they don't have the facilities. It must be cultured. So that if it is there, they have checked, they can't see it, they will still culture it. As they try to grow it that's what we use in the lab. And if it is there, it will grow to significant amount that they can now see. And that is the gold standard anywhere in the world. But because of the challenges in developing countries, we've been using that microscopy to diagnose, which has its limitation. But over the past years, modern methods have been introduced. This Gene Expert I just talked about will find it if it is there. The sensitivity is so high. You know that in Nigeria, because of a lot of reasons, people present late to healthcare facilities. So this malaria is typhoid. Before they find out, you know that it's TB, most of the time they've not gone to a healthcare facility. They'll be going to chemists. Why? Well, yes, we need to have first aid things all around us, yes. But you have gone to a place for first aid 1 week, you are still sick 2 weeks, 1 month. What are you still waiting for? You don't need any prophet to tell you that it's good for you to go to hospital. And then when we say hospital, we know there are several hospitals. This is Nigeria. Everybody's trying to survive financially. So that's why we have a lot of fake and genuine things all about, not only in healthcare practice. So you have to make sure that you go to a place that is genuine. Okay? Most government centers will be genuine. And if you are patronizing private centers, you have to make sure it's a genuine place. Okay? And then with this information that you are hearing, there's nothing bad in you reminding your healthcare provider, please, I want to be checked for tuberculosis. Because you just hear people using medicine for all kinds of ailments. You know, where are your meds? Let me see. They show you anti-malaria and anti-typhoid, so to say, that they've been using repeating almost every 2 weeks, collecting from patent chemist or from one relative that works in the hospital, from one similar drugs. So they compound their problem, they overburden their kidneys with similar drugs in different forms of dosages. So let's evaluate ourselves. When our cars are giving us trouble, we look for specialists, isn't it? We go to the right places and we get the car. What about our body? Some of us do as if we have spare parts or spare lives that we handle. It's God that keeps, so we have to do our own part. Get evaluated properly and get treated. You don't have to die from tuberculosis. It is no longer an untreatable disease if we detect it and you take the appropriate treatment. There's a control program going on in Nigeria, so it's beyond what I feel like doing or what the other clinicians feel like doing, except the patient insists that I want to be treated privately. Okay, there's a program that they will just refer you to the control program. There's a DOT clinic in every center where what we do because of the seriousness about treating tuberculosis, the management is called directly observed treatment, short course. They'll be giving you your drug and find a means of ensuring that you are using this drug on a daily basis, and the drugs are free. Depending on other comorbidities that the patient might have, you may have to pay for other tests to treat you comprehensively, not just let's treat tuberculosis and leave the diabetes. Let's just treat tuberculosis and leave whatever it is. The HIV, no. So you may have to spend some money for other things, but those things that have to do with TB strictly, they will be paid first. For health personnel, it's good that we do all our work as if we're going to give accounts. Okay, because we are all stewards in whatever position we find yourself, whether in the healthcare industry or we are in politics or you are in business. We should remember that we didn't actually send ourselves to the world, and we're going to give accounts one day. So we approach our work like that. And then secondly, the fact that the person you are treating, you might be the last hope for that patient. The person might have been going up and down. Maybe it's just by chance that the person has decided to come to where you are. So you must be purposing your heart to help this patient as much as possible.
As the words commemorate the World Tuberculosis Day, it is important for everyone to come together and fight this monster before it becomes a dragon.
There's nothing to be ashamed of, except if you want to be ashamed, you can always find reasons to be ashamed. But if you look at that reason very well, discover that there's no reason to be ashamed for anything. There's no reason, because you have only one life in the first place. You have only one life. And then the earlier the better. People that are ashamed are afraid of other things. It's fair. Would they say it's cancer? Would they say it's HIV? Would they say you are afraid of what you don't even know? Sometimes it's common asthma, not even tuberculosis. This is our days when the whole world is facing the COVID pandemic. It might be COVID. It might not be COVID. It might be TB. It might even be some other fungal infections. Aspergillosis is there. In some areas, part of this country, we have histoplasmosis there. It might not be TB. The only way to know whether it's PTB or not, or to know whatever it is and get it sorted out, is to go to a reputable institution, go to a genuine healthcare provider. and get yourself sorted out. Not they say, maybe I should try this. They say, why will you be going to this? When you want to treat your car, you don't go to that roadside mechanic, that car that you really cherish. You go to the one that you know that this one knows what it's doing, isn't it? So please don't let's postpone. If you don't treat your TB in 10 years, it's going to within 10 years. Leave with thereabout, the person will die. Will die of one thing, one complication or the other. So the earlier you get it sorted out, the better. TB is curable. There's no stigma about it. That they will say, go, go, go. No. Even COVID, people are coming out that they have COVID. If people are not agreeing to allow themselves to be stigmatized because they have COVID, so why will you allow yourself to be stigmatized? The worst is they say, wear your face mask, okay? Because you have TB. Even those that are not having TB, are we not all wearing face masks? So that's one of the things that can happen. Where I know these TB people wear your face mask. But healthcare providers too have been cancelled from time to time so that as they deliver their duties, they are not speaking in a way that the patient might take personal offense. Okay, because some people can take offense at almost everything. It's asking to wear my face mask. You also know that you owe the community that duty of protecting every other person from having it. So you wear your face mask. Because that's one of the challenges. Where you are in the community, you say wear your face mask. At least for the first initial phase of your treatment. When we know that you will still be actively disseminating this germ. So protect your loved ones. Having tuberculosis is not a death sentence. Even now, having so many diseases that people have either to fear, cancer, all those, they are not death sentences. If you have been diagnosed, you better get treated because it's a matter of time. If nothing is done to kill those germs in one way or the other, it's a matter of time. Death is inevitable. But it's not only even that death is inevitable. What about the spread to your loved ones, to people all around? And then if you are using drug and you are stopping, you are creating a more difficult situation for yourself and for the people that will contact this your own strain of Mycobacterium tuberculosis that might have already become drug resistant. And we have to be our brother's keeper. Let's keep ourselves, let's keep our brother. And in the healthcare settings, our clinicians and even non-medical people in the healthcare setting, all of us, the media, the politicians, all of us, we have to put in our hand and do our own bit in making sure that we support finding the cases, diagnosing tuberculosis, we support them going for their clinics, we encourage them in using their drugs. Those people that poverty actually predispose them will find a way of improving their standard. Because if they go back to that same standard, as you are treating them for tuberculosis today, they are coming back with another one. Not because you didn't treat the previous one well, because of reinfection for one reason or the other. So it's a multi-sectorial approach that can help us in eliminating TB. Like the whole world has been targeting 2030. In fact, by 2022 next year, we should have attained a significant milestone in our goal to eliminate tuberculosis. But we are far from getting there. We have even been experiencing some setback because of the COVID challenge. So this is the right time to wake up and fight this menace before it becomes a dragon.